This is a patient that we have decided to treat with the Fraxel repair laser. He's a young man who had severe acne that left him with severe contoured scarring on his temples, on his forehead, and some areas on the cheeks. The first thing we do is put him under harsh lighting to identify all of the defects where the rolling and contoured acne scars are present. And so what we're doing here is we're creating harsh lighting, because then we can see all of the contour defects that we're trying to fix. And by creating this sort of shadow light, tangential lighting is what I call it, it brings out all the stuff we're trying to work with. All of these areas are rolling scars, contoured scars. And the reason we do this is when we put in the anesthesia, it flattens them all out and you can't see them anymore. Then the other thing we're going to do is mark the areas where we're actually going to do the laser, and I've concluded this because it has some prominent pores and a little bit uneven texture. The next thing we do is fill those areas full of dilute local anesthetic. I like to treat the whole face with something so they blend and look better. So we're going to do a chemical peel on the areas, on actually the whole area, so that we blend in the areas here, and that actually makes the skin look very nice, and then you don't just heal with 3 or 4 big red blotches from the laser. So here we're using an instrument that has a little flat tip on it and a curve, and we make a little tiny entry point right here by the sideburn, so it's up in the hair, and we introduce this with the blade up because that keeps the plane of dissection, and we go through and release all of those scar bands. Once we've released those scar bands, we go over those areas in 4 or 5 different directions with a Fraxel Repair 135 micron handpiece at crisscrossing directions, using that handpiece to blend and randomize the treatment so that they get a nice blended result. We're at 30 millijoules and 40% coverage, treatment level 10. So that's my second pass on the neck, so I'm going to stop above that red line on the rest of the passes. This is also a very quick treatment compared to stamping methods. You can cover a large area very fast. Okay, I'm stopping at the top of this red line, only 2 passes down there. And then I'm going to do a 5th pass across the worst scars. So he's got a area there, maybe even a 6th pass to blend that. Little one there. And then this is a bad area here. We'll do another pass on that as well. When we use the Fraxel Repair laser, it has a little speedometer on it that tells you if you're within the speed limit on that device, then you're laying down all of the dots that the laser can possibly lay down. If you speed up a little bit, it actually makes it so you can use that to blend, because you will lay down fewer dots if you throw a few dots off the end and speed up the rollers. That is a nice blending technique that can be used to blend areas that don't need as much treatment or where you're just trying to feather the edges. So we'll speed up a little bit at the edges. We'll go different crisscrosses, usually horizontal, vertical, and 2 diagonal passes, and then sometimes a 4th or a 5th pass on some of the more difficult scarring. That way we're blending everything together. It's very important to respect areas where the skin will not heal as well. The area of acne scarring is the #1 area that I treat with the Fraxel Repair laser. Non-ablative lasers will get some improvement over a period of 4 or 5 treatments. However, with the combination that we've demonstrated using tumescent anesthesia, extensive subcision, and the Fraxel Repair laser, our average improvement is 72% in 1 treatment, and that's on 114 patients with 156 views of their before and after photos. With this, the laser treatment, we're actually making holes down through the skin that are a little bit over 1 millimeter deep. As those holes heal, they pull the skin together. They actually remove some of the tissue, and they also stimulate neocollagenesis. so you get a younger, more healthy skin in the areas where we've had the scarring.